Damson Purif beams as he shows members of a support group photos of his infant nephew on his iPhone. The 68-year-old geologist is charismatic and jokes with the others gathered in the room in the Ulaanbaatar. But his mood changes as he begins to recount his long experience with hepatitis, a disease that has blighted his life. Purif was diagnosed with hepatitis B and C in the early 1990s. By the end of the decade, his health and quality of life had deteriorated, leaving him constantly sick and fatigued. He had to sell his business to finance a trip to Korea to undergo treatment, which was not successful. Financially, I just went down, he says. Once back in Mongolia, he was unable to afford hepatitis drugs, and began to lose hope as the disease continued to affect his liver. I was really scared, says Purif. My dad and all the relatives on my dad's side died of liver cancer and liver disease. I didn't want to be one of them. I just wanted to keep fighting and cure myself. Fortunately, he heard about the non-profit Onam Foundation, which offers screening and treatment for hepatitis. Today he is cured of hepatitis C, has low levels of hepatitis B, and the health of his liver, which at one point was 2/3 non-functional, has improved. Purif has been lucky. According to the World Health Organization, Mongolia has the world's highest rate of liver cancer, as well as the highest mortality rate from the disease. Each year, liver cancer and liver cirrhosis account for 15% of all deaths. Chronic hepatitis is the most common risk factor in developing liver cancer, and 400,000 of Mongolia's 3 million citizens are diagnosed with a hepatitis virus. The National Cancer Center, which this year will begin performing liver transplants. Photograph Hannah Griffin, who says hepatitis cases spiked in Mongolia in the 1970s and 80s, when syringes were regularly reused and dental and surgical practices were not always hygienic. Additionally, the country has high rates of hepatitis B and D superinfection, which occurs when someone with chronic hepatitis B becomes infected with hepatitis D. There is no other country in the world that has a problem like this, says Dr. Naran Batur-Durj, co-founder of the Onam Foundation, which runs group therapy sessions for those like Purif living with hepatitis in Mongolia's capital, as well as providing hepatitis screening and treatment to thousands of people. But the government is waking up to the health crisis, pouring significant money into screening and treatment in an attempt to reduce cases of liver cancer. By 2020, ministers want to eliminate hepatitis C and significantly reduce liver cancer and cirrhosis deaths. Last year, Parliament ploughed 23.4 billion Mongolian tugruk £7 million into the country's health insurance scheme to subsidize hepatitis medicine. This year, the government allocated 226 billion Mongolian tugruks for screening and treatment until 2020. This money also covers free hepatitis testing for those between the ages of 40 and 60, who make up the bulk of liver cancer patients. This will be extended to a younger cohort in 2018. This cash injection will reduce patient costs drastically. After subsidies, patients pay between $3.02.25 and $13.09.70 for hepatitis B medicine, and between $65 and $215 for hepatitis C medicine. Before subsidies were introduced, medicines could cost thousands of dollars. In the area of treatment, Mongolia is making really good progress in screening the people, identifying people with chronic hepatitis, says Naranchuya Jadambas, a technical officer in Mongolia for the WHO. But we need more work also to stop the transmission within the whole society. It would require more efforts and even more financial support as well. The National Cancer Center, a busy hospital where Mongolians from all over the country come for diagnosis and treatment, performs 450 liver surgeries a year. This year, it will start performing liver transplants. Dr. Chinburan Jigjid, the center's general director, says in the past 2 years approximately 160 Mongolians have traveled overseas for transplants. He hopes more people will now stay in country for surgery. About 70 people are on the government waiting list for a liver transplant. Dr. N. Yumchin, head of the Intervention Radiology Department at Mongolia's National Cancer Center, explains that their angiographic equipment is outdated. If the equipment fails, it would be difficult to find spare parts to repair it. Photograph Hannah Griffin. But a major factor in reducing liver cancer deaths is early diagnosis. Many Mongolians are not diagnosed until they are late stage and inoperable. Jigjid says many people travel from their rural homes to the capital only to be told there is little that can be done. He hopes the center can establish a system to connect provincial health centers by internet so patients can have online consultations with doctors prior to coming to the city. We are trying to avoid this problem and trying to establish a good system, he says. I hope that Mongolia will be an example to the world on how we fight liver cancer. Mayam Javjag Alsaykan, 63, is another member of the Onam Foundation's support group. He was diagnosed with hepatitis C and liver cirrhosis 30 years ago, and had been receiving treatment each year. In 2013, after retiring from a 40-year career as a technical engineer at a printing company in Ulaanbaatar, he was diagnosed with liver cancer. Just as he was ready to enjoy a more carefree life after years of hard work, he was sidelined. Any plans I had made for the future just all stopped, he says. But unlike many other patients, Jag Alsaykan's liver cancer was operable, and he has been cancer-free for 3 years. Despite all the challenges, he considers himself fortunate. I really consider myself lucky to have had the disease for so many years and survived it.